We thank y'all for coming tonight to celebrate the 65 years here at the College of Nursing, and I would like to introduce our first speaker. We're so glad that he's still here for this event, and Dr. Randy Webb.
You know, Northwestern as a whole is a historic institution of higher education. In fact, when you think about it, teacher education in Louisiana was born at Northwestern. Normal Hill on the Natchitoches campus is the longest standing site dedicated to post-secondary education in the entire state of Louisiana. But let's don't leave nursing out. Nursing is a leader in the state of Louisiana, first baccalaureate degree program in this state, and we've grown to include associate degrees, masters, and now, after a lot of work, diligent work, the Doctor of Nursing Practice, of which we're extremely proud, and I agree with you. We want all of our students to apply ultimately for enrollment in that program because we think it really is a profession-changing program that can make a lot of difference in your lives and the lives of patients as well. You know, we're in Shreveport today, the headquarters of our College of Nursing and School of Allied Health, for one primary reason: the vision of 5 hospital leaders in the Shreveport area many years back. They were the ones who went together and called upon Northwestern to inaugurate this program, this very special, outstanding nursing school that we have here. We're fortunate today, by the way, that we still have visionary leaders in our hospitals in this area as well as in the healthcare professions, and it's just really an ideal place to prepare nurses and medical doctors and other people in the healthcare professions. It's just ideal for that purpose. And we know this. We at Northwestern know that the nursing program is an area of excellence within the university. We know among ourselves we're just the absolute best when it comes to that. But you know, I always go around looking for what I call third-party validation. I don't want to just have it be us saying this. When U.S. News and World, 2 consecutive years, ranks our graduate nursing program in the top 100 in America, that is third-party validation. And it says a lot about graduation, too. And you want to know what's funny about that? We didn't even have a doctoral program during all the reviews they made at that time. Just wait till the DNP gets rolling. It's going to make a tremendous difference for the better. We're dedicated to the fine faculty, staff, and administrators in nursing at Northwestern over the years for making this place what it is, a citadel of excellence in nursing and allied health, and I'm just so grateful to them. But we are especially grateful to our graduates. There's no way U.S. News and World, for example, would have ranked Northwestern as a whole as a Tier 1 Southern Regional University if it weren't for the outstanding accomplishments of our alumni. And so I want to congratulate and express appreciation to our alumni from nursing and allied health and let them know that they are really the finished products and in many instances works in progress as they pursue additional education. They are the people who are Northwestern to the general public. So anytime I'm in a healthcare facility, the first thing I ask is this a Northwestern nurse? I'll always ask it. I'll try to overlook it if they're not, but I won't be happy. I will. So y'all look for me if you see me in need.
When you ask people what they know about Northwestern State University, they'll talk about it being a teaching college as it was the normal school. But 90% of the people will talk about the nursing program. and how important that nursing program is, not just to Northwest Louisiana, but to the entire state. I saw a statistic that just floored me the other day when I was just reading up. I had to come speak to students, and you have to do research before you speak to students because they will nail you. I came to spoke to students Monday. But the statistics said that the 5,000 nurses that work in the Shreveport-Bossier market contribute $250 million to this regional economy. That is amazing. That is absolutely amazing. And for a workforce and economic development guy, those numbers are compelling. But nursing goes so much further than that. It is such a noble profession that adds to the richness and the quality of life for every single person that lives in this region. And I'm so proud to be a graduate of Northwestern. I met my wife. We were married when we were seniors at Northwestern. We took a more academically rigorous path. We were journalism majors. But, you know, some people need to come to nursing program. But to be associated with a university that has a nursing and allied health college that is so rich in tradition, so storied in innovation. Almost 10 years ago, I had a problem with technical colleges around the state of Louisiana because they just needed to develop their faculty. The first call I made was to Noran Planchok, and she and Maxine quickly said, that's no problem. We'll create a master's program designed specifically for practical nurse instructors at technical colleges. We're just beginning to see the results of that willingness to innovate and respond to needs in the quality of the students that are being produced from technical colleges, the 42 campuses around the state, simply because someone was willing to say yes and find a solution. And you could multiply that one decision point many times over. And I'm so delighted to get to work with Dr. Clausen, the new dean, the leader of this program, and to see the future of this college in Shreveport-Bossier and the impact it's going to make on this state. Our vision is limitless, and I have no doubt we're going to realize that in very short order. So here's to the next 65 years. Thank you all very, very much.
I truly grew up in this school. Dr. Simmons was one of my associate degree instructors. Billy Batowski, I saw here, I think she had to leave. There are many people who taught me in this program. Deborah Clark was my first faculty mentor when I came on as teaching ASN first level and didn't know anything about how to teach associate nursing, and she really mentored me into that role. So I have grown up here. I feel a little bit of everybody when I walk through the doors. And I hope that I do as good a job in the next few years as everybody before me has done. I know Dr. Henderson has said it's going to be a great next 60, 65, 70 years. I really believe the best is yet to come. But we couldn't have done it without a great foundation. I mean, we have a great foundation at this school. And he's right when we go out into, Dr. Webb's right, when we go out to advertise for our students, we don't have to do much advertising. The hospitals want us. The healthcare centers want us. They want our students. They're the first ones hired from Northwestern. So we thank you for being here tonight.
We are so thrilled to have you with us tonight, and I am not going to go to the full history, but just hit a few milestones. As you guys know, we admitted our first class here in Shreveport in 1949, the fall of 1949. And we had that happen because there were so many nurses in the Shreveport area and health professionals who were so visionary. At that time, there was a move on nationally to move diploma nurses who held certificates from hospitals who were not classified as institutions of higher education. And they realized that they were hindering their diploma graduates by not moving forward into a collegiate program. So 5 hospitals in this area got together, brought in a consultant who looked at Centenary and Northwestern being the schools that would most likely be able to house and support a baccalaureate program. And since we were a state-supported institution, and one of those hospitals was Shreveport Charity Hospital, and they gave over their facilities to that first class, and we just moved in there. Those hospitals were Shreveport Charity Hospital, and the facility used to be on Murphy Street down here where the police station is now. And the hospital was down there. And they built us a whole new facility on Kings Highway when Confederate was built. So we moved over there. So we've moved several places in this city, but we've always had a presence in Shreveport. In the early 50s then, we opened because we had a statewide outreach, and they requested us all over the place. So we opened a campus in Monroe at E.A. Conway Hospital, one in Alexandria at Baptist Hospital, one in Baton Rouge at the Baton Rouge General Hospital. And ultimately, we consolidated to Shreveport. And then we had a psychiatric campus in Pineville. And there are a number of pictures from that campus because Grace Riley, who was the director of that program, was visionary and got Mr. Urbach from Natchitoches to come to Pineville and take all kinds of pictures every semester down there. So we have a goodly record of the Pineville campus from her efforts, so that was real good. We moved into Warrington, which is a block up the street. We consolidated in 1970 up here, and then we moved into Warrington in the late 70s, and then into this facility in 1985. And as you can see, we probably need to go up or out or somewhere else, because we have on this campus 600 face-to-face students and about 400 students who are internet students who come to this campus to use the facilities. And you probably noticed the library downstairs. There are no books anymore. All of our library resources are electronic. So right now we have a campus in Alexandria, one in Leesville now. We're going back out, but we're kind of maintaining a regional effort. And one at Leesville, Fort Polk, this one in Natchitoches. And our library is a part of Watson Library on the Natchitoches campus. So every student enrolled has access to any resource that we have available electronically. And the librarians have just done a momentous job in making those resources available. And I don't know, I guess is Paula still here? Paula has now, she's the librarian here, knows more about nursing literature than most of us do. So she is really a fabulous resource to us. Well, I guess the biggest milestone, we were the first baccalaureate program in the state-supported. Dillard was actually the first baccalaureate program, and it was a private institution, just a couple of years before Northwestern. And then we had the first associate, baccalaureate, and master's programs in any university in the state. We had the first master's program that began in 1972, and we were real proud to have had the support of a federal grant to initiate the first family nurse practitioner program. It was called the Family Nurse Clinician Program at that time. And the graduates were called by the Board of Nursing Primary Nurse Associates, and they were approved by rulemaking. So it wasn't until we got to that battle in 1995 over prescriptive authority that we got them recognized in statute. So that's been a long, hard battle. And then I guess the last, we were not the first DNP program, but we really had, I have to tell you, we did many years ago, we had the first PhD letter of intent submitted to the board many years ago, before LSU, and we had probably the first DNP letter of intent submitted some 7 years ago. So we've just kind of been a political ball game in a political ball game, but we're here to tell you that we're strong and and going forward and growing all the time. And we're just really thrilled that you guys are here with us. We've had 7 deans. Dana is the 8th dean. And Debbie, is Graham Price Strain's picture downstairs? The very first dean was Graham Price Strain. And I don't know if you guys remember, but Dr. Fred Price was a family physician here in this area, and she is his aunt. And they were going to try to be here tonight. And she got out of the Army Nurse Corps, and she had a master's, which was rare at that time, and was working at the Office of Surgeon General, and came down to Louisiana to be the first dean. And she was here until it got started and left after 3 years. So she was followed then by a lady from Pennsylvania. Not many people know about her. There's only one picture in a potpourri. Her name is Frances McKenna, and she lasted 2 years. And then Hilda Burnham came, and she was the dean when I was in school. And yay, and here's some of my classmates here. And she was followed by Etta Ann Hinker, and then Etta Ann was followed by by Peggy Ledbetter. Oh, how could I forget that? That's one of the first one that I had to break in now. And then Dr. Ledbetter was followed by Dr. Earhart, and Dr. Earhart by Dr. Planchok, who is with us tonight. And now we have Dr. Clausen, who's going to lead us forward into the future. I have 54 years of direct association with this university. But we have tonight a person who is here from the first graduating class in 1954. Is there anyone other than Miss Marcia Roseman here from 1954? Miss Roseman? Oh, we have another one. Yay, 2 classmates? Come on up here. We call them the earliest graduates. We don't want to call you the oldest.
Thank you. We are the oldest.
And we have a little token for them wherever they are. Oh, Gil, in the kitchen?
They're on top of the refrigerator.
Okay. What we've done is to do a little plaque thank gosh, there's 2 of you because we did 2.
You knew she was
Yeah,
coming.
you were our first Angels of Mercy. And so we've done little plaques to kind of commemorate this for you.
Oh, thank you.
Thank you. And your name?
Virginia Lynch.
Miss Virginia?
McDonald.
And your maiden name was McDonald then?
McDonald, yeah.
And would you like to say something? I know this one is never at a loss for words. Here, get in front of the microphone.
I am tonight. Nursing has been so good to me. I spent 40 years with the children in Caddo Parish as a school nurse after I raised 4 of my own. So I love nursing, and I hope that I will continue to be healthy and see the students that I taught as students when they come into Kroger's, into the big chain. They always call me Ms. Rose. So Ms. Rose, they'll run up to me and hug me, and that means so much to me. Thank you very much for all of you, what you have done in the field of nursing. It's a noble profession and one that will never die because we're always needed.
Feel free to stay and mingle a little while. We just appreciate having all of you here. Thank you for being a part of this celebration.
Yes, no. In fact, I think David's gonna put you on right. You have anything you want to say?